Good morning, church, and praise the Lord. I think before I start, I want to congratulate the church because of all public gatherings. This is the safest place that one can be. I have not been here. I've come to church maybe 3 times since the COVID problem started. And I have seen the improvement as we have continued. And I think this is the safest, even for the seniors. I'm proud to say I'm among the seniors. And I think it is safe even for the seniors because the church has followed all the protocols that are needed. Unlike all other public gatherings where you see people breaking rules without care at all, and that is why we are in this place, in this situation at the moment. So the state of the coronavirus pandemic here, I won't say much. We all know we are now in the 4th phase, the 4th wave of the pandemic. And it is affecting now. Initially, it was mainly urban. It was Nairobi and a little bit of Mombasa. But now, it is a lot of rural and urban involvement, Nairobi, Mombasa, and Kisumu. But everywhere we have, I won't go into the figures, but we know we have now about over 218,000 cases confirmed, and over 4,300 deaths reported. But I believe the numbers are many, many more than we are seeing, than we are being given. People are dying without being tested. People are getting sick and they're not going for testing. So probably we are having bigger numbers than we are actually seeing being recorded. I think our new daily positivity rate is over 14.5. I want to say a little bit about the virus, the coronavirus. Like all other viruses, it is continually mutating. It is changing form. And some of the forms, the mutations, are dangerous. There are some that become more transmissible. In other words, they can be passed much more easily, or because they are evading the efficacy of the vaccines, and they are causing death. They are the ones that are called variants of concern. And at the moment, there are 4 variants of concern that we know about. The first one was the UK virus. The one from UK, it was called the Alpha virus. Then we have a Beta virus that was identified first in South Africa. There's one Gamma from Brazil. We have yet to identify it here. And then we have the Delta that was first identified in India and is the most prevalent now all over the world. The Delta variant has become the most dominant because it has many mutations, it is highly transmissible and spreads very efficiently. It is more transmissible than by about 30 to 60% of the Beta variant. So it is very contagious. The symptoms tend to appear even earlier, by 4 to 6 days, and it remains infective much longer, by up to 18 days. Before we were saying 10 to 14 days, you are practically non-infectious. But this Delta virus is staying a little longer than the others. It has very high viral loads. In other words, if you take the swab, the count for the virus will be very, very high, even in those who are asymptomatic. In fact, the asymptomatic, the phase where before you get infectious, before you show symptoms, that is the time the virus is, for almost all viruses, you are most contagious at that time. But even those who do not develop disease, they are still infectious. And even the ones who have had the vaccine, they are still infectious. They are contagious. The virus is very, very contagious, even among people who have had the double vaccines. We used to talk about, earlier on, we used to talk about that the only time we shall be able to control this disease is when it comes, when the herd immunity is raised between 60 to 70%. Herd immunity means that most people have had contact with the virus, either through a vaccine or by natural infection. So, like the flu virus, most of us have had contact with the flu virus, and therefore when it comes, it just passes as a cold, but the coronavirus has not reached there. The Delta virus, we are told now, has raised the bar to about 80 to 90% herd immunity. That is something very difficult to achieve. And so, it is important for all of us to follow the protocols as we are required. And especially because I've said, if you don't have symptoms, you are also still infectious. In fact, in this country, about 90 to 93%, from the statistics we were getting earlier on, 90% of the people who are infected never show symptoms. And so the person who passes the infection to you is not the one you are seeing who is sick. It is that person you are not afraid of. I get asked by people when they come to my clinic, I tell them this is COVID. They say, it can't be. I have been staying at home. I have had no contacts. I don't go out. But I tell them, it is that person whom you are not afraid of. Your son, your daughter, your brother. They don't look sick, and they don't, therefore, you don't need to, you remove your guard, you eat together, you laugh together, and so you pick it from them. And that's why you see it is so devastating for families. Because when one person gets, several others also get it, and that is very, very sad. So, the asymptomatic phase, or those people who have no symptoms, are still very dangerous. And that is you and me. And that is why this, the way we are, is very, very good. And that's why I congratulate the church. One of the things that I would advise that all of us, if you get contact with become a contact of somebody with the coronavirus, go and test. Please don't refuse to go and test. Go and test. And if you are positive, isolate yourself. Don't go around. Buy yourself an oximeter. An oximeter is, all of you, I'm sure you are familiar with this gadget. It is very useful. You check your oxygen in the every so often, because if it is falling, if you get symptoms, you have mild disease and you can be isolated at home, you need to monitor your temperature and your oxygen, so that if it falls below, say, 92, you need to come and see the doctor. You need to go to hospital, because then you might be getting into a phase where you need oxygen. If you get to need to be admitted, then you have severe disease and you need the doctors in hospital, and there are those who will also go into critical disease, and they will go into ICU and get oxygen by mechanical ventilation. We pray that none of us, or none of you, or your relatives will get there. I believe, and as the Psalm 116 was being read, I said, yes, this is the Psalm of the day and of the situation, because we all here because God has protected us. We can all answer the question, what shall I do to the Lord? What shall I give to the Lord for all his goodness to me? Because I'm here because God has been very gracious to me. And so, let me say a few words. Maybe I'll be given a few minutes off just to say about the vaccines. There are a lot of people I've heard, they are waiting for the Johnson & Johnson vaccine because it is a one shot and we are okay. Let me say that all vaccines are good. And the best vaccine is the one that you can get easily. And the AstraZeneca vaccine is the one we are getting very easily. Go get it. It is safe. It is good for all of us. I've had both, and I'm not boasting that I have not had anything, but it helps and protects you. Whatever degree of protection it gives you, it is important. We have been told about 50 to 60% that from some studies, like REACT study, they said that the Delta variant, we have several vaccines, the AstraZeneca, the Moderna, the Pfizer Biotech, the Janssen or Johnson & Johnson, the Sputnik, there's also a Chinese one. All these, whichever you get, is good because it has some protection. But the Delta virus is reducing that efficacy to some extent, but it is still good. It lowers, we are told that between 50 to 60% you get a lower risk of infection from the Delta variant, even when you have had 2 doses. So instead of, say, the 90%, it is lowering to 50 to 60%. And from Israel, we have been told, because they vaccinated almost everybody with the Pfizer vaccine and the Moderna. And even there, the Pfizer, that is why we should not say any virus is important, any vaccine, there are any vaccines that are better. Even the Pfizer is lower, the efficacy has dropped from 94 to about 64. From Scotland, Public Health Scotland, they tell us that AstraZeneca efficacy has dropped from 73 to 60, but that is still very good. So don't refuse the vaccine because of that. You should be vaccinated as soon as possible. We have now been given opportunity for all those above 18 to get the vaccine. Please go for it. Now, what about the side effects of the vaccine? Every medicine you take has side effects. Everything, even food that you eat has side effects. That's where you get obesity from the food. That's where you get diabetes from the food that you're eating. Everything that you do, crossing the street has a risk. And you never say, I'm not going to cross the street. You are more likely to die from crossing the street, Uhuru Highway, than from getting the vaccine. So please remember that the vaccine, yes, there are those problems that we have been told, but they are much more rare, even the embolism that we have been told, it is much rare than from the coronavirus. Those who get the coronavirus infection, we worry much more because they get a lot of embolism, clots going to the lungs, and they die from that. Even people with mild disease. We have seen people who have gone home and come back and died from the embolism, from the clots that form. So please get yourself vaccinated. It is safe and it is good. But at the end of all that, what is the most important thing? It is your social distancing, and that's why I've congratulated the church for what is happening. I was saying for leaders, because sometimes you may have to find yourself in those places where you can't help it, I would advise that you always use either an N95 mask like mine, or use double masking. If you use a surgical mask like the one I'm seeing all of you wearing, and a cloth mask on top of it, it raises that efficacy, the protection, to as good as this of N95. And so please remember, get yourself vaccinated. And if you must go into social places, keep your social distance. And if you must be very close, wear a mask, hand wash, and keep the mask all the time as much as possible. I want to thank the church for giving me this opportunity to say something, and I hope it will be of help. God bless you all.